Welcome to Health Talk. Today we're going to talk about minimally invasive techniques for facial rejuvenation. With us today in our studio is Dr. Jerome Liu, plastic surgeon, and Dr. Tom Liu, plastic surgeon. And we're going to talk about what's new for little tiny things that we can do for our face to look younger. So what is new for us, all of us? We're different ages here. What do you think?
Well, neither of you need anything.
Okay.
You
Oh,
guys
that's
are
very
beautiful
nice.
as is.
Okay.
But there's a lot of new techniques coming out, and I think there's constantly new products coming to the market. But I think it's from a broad level, it's important to divide these into kind of the things that they treat or the things that they do.
And what are those things that they treat, and what are the things that you do?
So when somebody comes in for facial rejuvenation, you have to analyze the whole face. So often they come with specific complaints, and we always listen to what matters to the patient, but we always kind of have to take that in the context of the overall picture. And so things are often kind of divided into different categories.
So here's a picture of the face, and I believe that you all look at it upper face, mid face, and lower face. So tell us a little bit, our home audience, how you view all these things. Here's a pen.
So the upper face, or we consider kind of the periorbital region, is just around the eye and above. And then the mid face relates mostly to the cheek area, okay? And the lower face refers to kind of around the mouth and the jawline. This is actually a kind of a interesting picture because that doesn't have the skin, it only has the muscles on it.
So now, usually at different ages, there are different issues. So obviously the young Hollywood starlets start getting their stuff done a little early, like in their age 24 or so. So what is a concern for people who are in their 20s and then their 30s and their 40s? So is it first, is it the eyelid sag at age 24? What is the magic number in Los Angeles that drives all of America?
Well, different decades of life have their different aesthetic changes as well as their different aesthetic goals. So just to kind of broadly summarize, women in their 20s, some of the common procedures they would get is maybe they start to notice a little crow's feet on the corners of their eye. They want a little bit of Botox or Dysport. Maybe they want fuller lips, either because their lips are small to begin with, or they just want a little bit more volume, just to look, even more attractive, or to make that gloss or lipstick look really, really nice. Then in the third decade of life, they maybe notice a little bit more facial wrinkles, maybe some wrinkles between the eyebrows or on the forehead. They may begin to start to notice some skin changes, and they could benefit from some skincare to kind of control the fine wrinkles or the pigmentation. In the fourth decade of life, oftentimes the women have started a family, have had children. They're starting to kind of while they're raising their children, they have shifted their focus away from themselves to their family, but then now they're kind of reinvesting in their appearance. And that's the quote-unquote kind of the mommy makeover type category, where again, they may benefit from further neuromodulation as well as some fillers to treat some deeper wrinkles. And then in the age 50 or above, oftentimes you're looking at true gravitational and soft tissue changes where they can benefit from surgical procedures and also potentially soft tissue augmentation in addition to some Botox for maintenance.
And what are sort of these things that you are injecting into the face? What is the material?
So I think they can broadly be divided into several categories. The first is what we call neuromodulators, and those would include Botox or Dysport. And basically what it is, it's targeted therapy for hyperactive muscles. So when we make facial expressions or we smile really big, the muscles on the face contract, and over time the skin folds in the same place over and over. And with repetitive folding, the wrinkles, which are initially temporary, become permanent. So the use of neuromodulators or drugs in that category can relax certain muscles, rebalance the face, and actually possibly prevent the onset of permanent wrinkles. Okay? The second area is fillers, and as we know, as patients get older, we lose volume in the face. So typically we lose it in the temple area or maybe in the cheek area, and sometimes we get kind of deeper folds here around what we call the nasolabial folds, and also down here in the jowls. And so fillers are something you can inject to kind of smooth those contours, okay, or replenish volume in the face. And there's lots of different products in that category. Some of them are, for example, hyaluronic acid, which is probably better known as either Restylane or Juvederm, is commonly used for volume. Also, people use Sculptra, which is kind of more subtle but longer term lasting product to also fill maybe the temples or the cheek area.
Now here you have some syringes, and is this what a patient would see? This would be...
Yeah. So this is hyaluronic acid, and hyaluronic acid naturally occurs in the body, but this is synthetically kind of remade for injection. And it's basically a soft gel, and it works by pulling in water or hydrating, and that gives you the volume effect. So you may inject only a small amount, but it'll pull in some water to kind of fill that area. And the effects, depending on the product, typically last anywhere from 6 to 12 months. I think the more often you use it over time, there's probably some collagen deposition that makes it last longer and longer. But I always tell patients that the first time they use it, it's not going to last the 12 months that the manufacturer says, but the more often or with repetitive use, it may potentially last longer. And I can squirt some out for you. Do you want to feel?
Oh, okay. It's very smooth. It's a little, has a little consistency of a few little,
Kind of fine granules?
yeah, fine granules.
So it's very smooth, and it's, very kind of supple substance. It's very moldable.
It's like a gel, very soft.
Yeah.
Now, when you inject here for the eyes, for let's say, so they would be expecting injections where? Around the eye, depending on, I guess, their crow's feet? And depending on what filler you use, whether you use a neuromodulator or...
Yeah, so a neuromodulator is typically done around the eyes and to affect the crow's feet. Fillers and neuromodulators are very different, and their use is in very different parts of the face.
And so when a patient comes in, how do you decide, which one to use? Because obviously there are many options for different kinds of fillers or different kinds of neurotoxins into the face.
So a lot of it deals with kind of what works best for the patient. So I mean, the first thing is dividing the neuromodulators from the fillers because they treat different things. The neuromodulators treat kind of wrinkles that come and go around areas of facial expression. The fillers really treat volume loss. And so neuromodulators typically are used in kind of the frown area. The crow's feet are around the eyes. Sometimes we can use it in the upper lip for the lip lines. We can use it down low when kind of the corners of the mouth turn down a little bit. And we can use the forehead for some of the forehead wrinkles. Fillers are more for volume. So fillers can be used kind of down here in the cheek area, here in the nasolabial folds, in the marionette or kind of the pre-jowl area, and also in the temple area. So it's kind of very different in terms of what they do.
So by neuromodulators, the public knows it most commonly as Botox, and now there's Dysport. So they are actually a neurotoxin. So I'm sure that people have questions about that. So what are the most common questions the patient will ask?
Well, patients want to know that it's safe. And the dosages we use at the locations we inject it is very safe. But a lot of these medications have dual purpose, meaning they're used on the medical side, maybe for people with bad muscle spasm or cerebral palsy or things like that, where these are used to relax body spasms. And that's where you use higher dosages and you may see the potential effects of the toxin spreading. But in cosmetic doses and cosmetic uses, it's very, very safe.